chairperson and the co-chairperson to continue this session for the UG people also. Starting with the UG presentations, I now invite Arya Raj for her presentation.
Good morning, everyone, and thank you for the opportunity. This is Arya Raj, an intern from Dharma Ayurveda Medical College, Shree Perumbattur. So, my theme was Integrative Healthcare, Bridging Ayush and Modern Medicine. I wish to look at this theme through the eyes of GERD, gastroesophageal reflux disorder. Why this disease? Because it's something that begins as just and ends up unjust. Begins as just as in the sense it begins in smaller symptoms like sore belching, heartburn, etc., which we usually do not care about a lot. A small antacid is what we all take. This disease, or now a disease, very frequent disease, is affecting the life of today's youngsters, thereby leading to ulcerations and other stricture formations in the mid-period of their lives. That is within their 30s or 40s in the current era. It is a literature review with no case presentations, taken out of a lot of other research papers which has bridged two different systems. Some case papers I have observed bridged Ayurveda and yoga, while the others bridged yoga allopathy. Some others bridged Ayurveda and yoga. My approach is bridging all these three together. Why? We'll see in the next slide. This is where I got my references from. Bibliography is in the end. Symptoms. So symptoms include retrosternal burning, which is a common heartburn, eructation, reflex cough syndrome. So we'll never imagine that GERD can cause cough, though we have references in Ayurvedic scriptures for CASA due to GERD. It is not usually viewed from a modern view, matlab they don't take it. Immediately after GERD, they won't be thinking of CASA, or when there is a cough, GERD won't be one of the main things they would think about. There are many other small symptoms, like if we look at it alone, there are no big deals. Vomiting, flatulence, indigestion, nausea, burning in the chest, all of these are looked at from a very minor perspective. Together, they cause complications like strictures, ulcerations, etc., and sometimes even move through other systems, causing asthma, bronchitis, etc. Why did I give this slide is, some of the Ayurvedic medications from Sahasra Yogam and the research papers that I have viewed have treated conditions which are caused, which can be a cause, which are associated with GERD. Like as we see, the first column, Lagu Shuta Sekar Ras, Avipati Kara Churna, etc. come for the minor symptoms, like the burning or sore eructation. But when the associated conditions come up, we have more and more kashaya, lehya, rasa, etc. that help in the treatment. Like for the last one, we see Tvak Vikara and Amlapitta. Tvak Vikara with GERD, we have Kandu, Mandala references for Urdhva Gada Amlapitta. But that is not usually seen from an allopathic view immediately. They will know after a certain tests, but we have formulations. In the same way, there are many other related correlations. But mostly what people do is they go for antacids or alginates. Alginates are seaweeds, so they do not cause any side effects. But what they do is they cover the foot completely and keep the lining safe. This way it leads to indigestion and bloating, which comes as a side effect. Now I'm not saying we shouldn't take allopathic medicine. Allopathy does have a role to play, but not exactly here, right in the beginning. H2 blockers and PPI are what they are usually given or treated, are used to treat for the first stage of GERD, and these help to reduce the acid secretion, again causing indigestion or improper digestion and absorption of the food consumed. When a body does not get something in the level it needs, it produces more, which means one way it reduces the acid and the other way it also causes the increase in its production. Now yoga. Yoga, there are a few asanas which can be easy to do and doesn't require much of a flexibility. This can be followed by anyone within 5 to 10 minutes. Cat-cow posture, actually they are named as Matsyasana, Balasana, etc. But people know it as cat-cow procedure, child's pose, etc. So these are the asanas which help to increase the respiration, circulation, etc. in the abdominal region, and thereby helping in digestion and regulation. Now, this asanas alone won't help us, so we go through pranayamas. So, pranayama like Agnisar Kriya, Kapalbhati, and diaphragmatic breathing, as it is known today, is also used. These concentrate on stress reduction, abdominal strengthening, etc., which are some of the minor causes of the disease itself. Where does allopathy play a role? So allopathy plays a role when surgery is involved. One, when there are endoscopic procedures or laparoscopic procedures where this disease can be cured rather than prolonged or giving a symptomatic relief. When allopathy can give a complete cure, it is the best choice rather than giving asavas or arishtas again and again. Because when there is an anatomical defect, we have to correct it. A hernia, etc. are to be treated by allopathic medicine. Now, why did I choose this? Because if a disease can be cured by lifestyle disorders, there is no need to go through a vati, kashaya or lehya. If something can be cured by vati, kashaya or lehya, there is no need to go for a surgical option or wait till it reaches a complication, then undergo a surgical operation, surgical procedure for it. And with that, I conclude my presentation. Thank you.
Thank you. Your name, please?
Arya Raj.
Have this been tried in your hospital?
Sir, I'm an intern, so I do not...
No. Your guide or professor should have... Who is the author of this paper?
I do not have a guide for this, sir. I only study...
It's only a hypothesis.
Yes, sir. It is. The procedures are actually there, sir, for different parts of, like, different stages of GERD. These procedures are there. And I've also said that for different stages only. But only thing is, it's like the patient has been with the same doctor throughout and has reached a complication with the same doctor. If at all there was another mode of science that is involved, it wouldn't have reached the complication.
After making the presentation, you had made a file. Did you show the file to your doctor who's attended that patient?
Sir, this is not one case. These are a lot of cases.
No. Actually, you are missing the cause. What are the cause of the disease? That slide is not there.
Okay.
So that's why I'm asking you, did you show to your doctor who's taken this case? If you show this PDF, they will ask you, where's the Nidana?
I would have missed it, sir. I did not show it to anyone.
Yeah, that's what. You need lot of experience, and that's good actually. But you have to show to your somebody, a mentor or anyone in your college who's taken the class, as you have taken the case. You have to show. That's good. Thank you.
Thank you, sir.
Good effort.
For the next presentation, I invite Darshan Abraham Phillips.
Sarve bhavantu sukhinah, sarve santu niramayah, sarve bhadrani pashantu, ma karshit dukha bhavet. A very pleasant good morning, judges and my dear friends who have gathered here. Myself, Darshan Abraham Phillips, intern from Dharma Ayurveda Medical College and Hospital, here to present my topic on the management of migraine with Krikatika Marma, including a single case study. First, I'll start my introduction with what is migraine. Migraine, the headache, which gets worse with physical activity, bright light, loud noise, strong odor. And it is a unilateral, pulsative, throbbing sensation which limits in our day-to-day activities. It can be cured by GPANs or managed by GPANs and other preventive medicines, but it has little side effects, as we know. Now, in Ayurvedic terms, we can compare or correlate migraine with Ardhava Bedaka. When we see to its Nidana, it's Ruksha and Ushna Dravyas or Ushna Ahara, and we go detail into the Samprapti as mentioned by Acharya Charaka and Siddhisthana, we see that there is a Kapha and Vata aggravation which gets lodged in our shiras and hence causing pain in neck, temporal regions, eyes, ears, and even foreheads. I would like to go to a brief pathophysiology of migraine where the cortical spreading depression, the CSDs, which is a small waves of dural chemicals that travels, which gets inhibited or maybe less or more, which triggers the trigeminal system activation, which indirectly triggers the neuropeptide involvement. The neuropeptide involvements are CGRPs, substance P, NKA, and then causing problems with neurotransmitter involvement and central peripheral and sensations, which causes vasodilation and vasoconstrictions, which in turn we call it as migraine. Now, let me give a brief introduction about Krikatika Marma. Krikatika Marma is just, we can get it from name itself because it's present in the neck. I'll just point out that its location is antelope occipital joint. It's a Sandhi Marma and it's a Vaikalekara Marma. That is, if it gets hampered, it affects the associated spot with few anomalies. I would like to add on a point with Krikatika Marma as mentioned in Agastya Marma Shastra, that Krikatika Marma is one of the marma that can be self-induced, so that the patient can self-induce the marma to treat himself with a minimal amount of pressure. And when we see the deeper anatomy, it is located between the ligaments, and the main part I would like to point out is the vertebral arteries and veins and the anterior posterior primary ramus nerves passes through the Krikatika Marma. Hence, our impulse that we provide actually triggers the cortical spreading depression, and hence all the pathophysiologies can be regulated or managed in a good way. So, by gentle stimulation of Krikatika Marma, it enhances the energy flow, relieves physical tension, supports our emotional balance, it aids in pain management and improves the overall vitality as we have seen. Now, as shown in the picture, that Krikatika Marma can be self-induced, and that's how we actually saw a case. And this is my case study where a patient of 24-year-old male, he's a student, he complained of severe and recurrent episodes of left-sided headache with nausea since 3 months. His pain was so severe that we rated up to 8. It's unilateral left side with associated nausea, and his trigger factors were stress, anxiety, intense light and sound. The history was he had repeated recurrence of episode, and the episode lasts for more than 1 hour. We also did few other examinations, and the vitals during the episodes of migraine, we noticed that his BP and pulse rate were little aggravated. The medications that our guide provided was Patyaksha Datrayadi Kashayam, Drakshadi Kashayam on the basis of Agni, Shirashuladi Vajraras that contains Shankabhasmam, Hingulam, etc. And then Dologram is a medicine. And then along with it, we gave treatments such as Nasya, Pratimasha Nasya Anutailam, Shirodhara, Shirabaladi Tailam, Virachanam, Nitya Virachanam with Trivit Lehyam. And the main, as Marma therapy, we gave all the stimulations. And the specific thing we mentioned the patient was to stimulate the Krikatika Marma whenever he had regular episodes, when he was not able to treat. And when we saw the result, actually during the time of episodes, even though the efficacy of the Krikatika Marma was short span, he had an immediate relief, even though without taking a medication. So, my conclusion of the study was the Krikatika Marma alleviates the pain in Ardha Ubedaka using the Marma therapy. And hence, this Krikatika Marma is not a cannot be a permanent solution, but can be managed by the patient itself to treat the migraine in its severe conditions. Thank you.
Thank you. Who was your guide?
Our principal, sir, Dr. Jaishankar.
Okay. One more question.
Yes, sir.
Initially, you mentioned that Ardha Ubedaka is Vadaka
Yes, sir.
Bhaja and more of Ruksha Guna. Okay. Triggered by Ruksha Guna.
Yes, sir.
And you have mentioned Drakshadi Kashayam. Drakshadi Kashayam is Pitta Shamanam, not Vadaka Shamanam. Why did you select that medicine?
Actually, that
Any relevance?
no, sir. With regards to the Agni, first correction of Agni, he gave Drakshadi Kashayam and Patyaksha Datrayadi. Drakshadi Kashayam is only in the basis of proper making of the Agni, curing the Agni, and Patyaksha Datrayadi is mentioned in classics for Ardhava Bedaka.
Thank you.
Thank you, sir.
Next, I invite Vaishali for her presentation.
A very good morning to respected judges and everyone present here. I am U. Vishali from Shree Varma Ayurveda Medical College. I would like to share a case study on a patient who had undergone perennial pain for about 10 years of renal calculi. So yes, introduction. So renal calculi is basically, which is correlated in Ayurveda as Mutra Ashmari. So in incidents like in our day-to-day life, the intake of foods and processed food, which leads to so many disorders, but especially which causes the Mutra Ashmari. And it causes for all age groups. In Chennai's population is about 7 million, where 12% of the population is affected. And the factors such as inadequate water intake, unhealthy dietary habits, and excessive consumption of processed food and sedentary lifestyles. So, as I said already, the Mutra Ashmari, which is correlated in Ayurveda, the references is took from Charaka Samhita and Sushruta Samhita. So, in modern, we would do surgical or mechanical interventions. So, in Ayurveda, aims at only the disintegration and expulsion of stones. So I had done a case study based like a 45-year male who had undergone a severe pain in the abdominal region, where he would have 9 mm in the right side of the kidney and 8 mm of the left side of the kidney. So yes, the patient was suffering colic in nature and intermittent and rating towards the lower abdomen and groin region. It was very severe pain as it is compared with the pregnancy pain. Yeah, so right kidney which has single renal calculus which is measuring about 12 mm and left kidney is about 8 mm. And Samanya Chikitsa of Ashmari is that Ashmari Dharuno Vyadhir Antaka Pratimo Mataha Aushadasya Tarunaha Sadhyaha Praudas Chedanam Harati Tasya Purveshu Rupeshu Snehadi Krama Ishyate Tenasya Apachayam Yanti Vyadhir Mulanteshaha. So it is a Samanya Chikitsa for Mutra Ashmari. Where in Daruna Vyadhi, which is very serious, it leads to Yama, which is a god of death, and in Taruna Avastha it is cured with the Aushadas itself, and in Pravurta Avastha it is the advanced stage where we do modern as splittings of stones. So the Chikitsa is that the medicine medicine is Varunadi Kashayam is taken with warm water 15 ml and 15 ml each, and Gokshuradi Gugulu each tablets 2, and Chandra Prabhavati is 2 tablets, and Pashana Beda Churna is 3 grams, and Kulata Kwata is 50 ml. And Panchakarma, in Panchakarma the Niruha Basti and Anuvasta Basti is also said. And Patya and Apatya is also important for a renal calculi patient, where the Atya, Ushna, like Ahara, it is taken as Ushna Jala Sevana, Kulata, Yava, Mudga and Patola, etc. And Vihara is that timely, the patient should not suppress the urine urge, and he should regularly do a proper elimination of feces. And due to stressful life also, the reasons for Mutra Ashmari is done. And Apatya is that the intake of Ati Lavana, Ati Kattu and Ati Amla Ahara, and Guru Ruksha Vidahi Ahara, and Vega Dharanam is the Vihara which is done in and Ati Vyayama, and prolonged sitting and dehydration is also causes. So the role of manas, which plays an important role in causing the renal calculi, because due to this sedentary lifestyle the patients would cause stress and anxiety and fear. So for that this patient is causes severe pain. The patient exhibited Pravara Sattva. He has a strong willpower to face all kinds of pain. So the mental resilience of the patient is also very good, and Sattva dominance reduces the fear and anxiety, and he does not go to any kind of modern surgical practices. And Sattva Vyaja Chikitsa with supportive and conservative management. And asanas like naturopathy and yogic medicines also, yogic kind of therapy is also undertaken, like Pavana Muktasana, Malasana, Dhanurasana, Ardhamattendasana and Uttasana. And pranayama is Anuloman and Viloman and Bhastrika also be done. So result is that on 7th day the patient would feel a huge difference, like the improved urine flow was there without any pain, and burning sensation was also reduced, and pain significantly also reduced. Where the sizes were been no significant size yet, but mild stone mobility was found, where there will be some pain is also observed. And day 15 the pain minimal and no acute colic, and occasionally passage of sandy particles in the urine it was also there, because since it is the stone was very yellow, and the painful urination also caused. And the findings is that right kidney which has 12 calculus showing the fragmentation which is left, and kidney reduced size also the stones. So on day 30 the patient asymptomatic normal maturation was also seen, and the stone size also been reduced. Since the right side kidney has 12 the stone is gets into fragmented and it just passed out. Left kidney is totally completely it is removed. So conclusion is that not only internal medicines as Ayurvedic is done, even the naturopathy and yogic science and the manas which has a strong willpower to tolerate the pain, and it does not go, and the patient does not go for any kind of modern surgery. He just went through this Ayurvedic protocol and he had felt very good results. So the conclusion is that Yukti Yukta Ayurveda Chikitsa with Ashmarigna, Mutrala and Vedana Dravya is also supported, and Patya, Apatya and the Pravarasutta was also high, and thus the patient was very
Time
good
up,
with
time
this. Okay, thank you.
Thank you. Which year?
For the next presentation, I invite Shruti KR.
A very good morning to one and all present over here. Today, I, KR Shruti of second profession BSMS, National Institute of Siddha, going to present my presentation on the theme for internal and external therapeutic approaches for chronic illness. Today, I've chosen the major topic of type 2 diabetes mellitus, and this work was guided by my professor, Dr. B.R. Sendil Kumar, head in charge of Udal Tattvam department. Okay. So we know that the type 2 diabetes mellitus is a metabolic disorder majorly characterized by the chronic hyperglycemia, which is often associated with the insulin resistance. And the chronic cases also involves associated conditions such as diabetic neuropathy, nephropathy, retinopathy, cardiovascular diseases, and impaired wound healing, which leads to necrotic ulcers and gangrene formation. Significantly, it affects the quality of the life of the patient. According to Siddha, the diseases are classified 4,448 types, out of which Meganeer is one of the type, which is further classified on the basis of the derangement of the vital humus Vadam, Pittam and Kabam, in which the Vadam involves 4 types, so Pittam involves 6 types, and the Kabam involves 10 types. So the objective of this review was to identify the internal formulations in Siddha, which was given for the management of type 2 diabetes mellitus, and also the external therapies, which was helpful in the diabetic care as well as the complication associated with it, and to summarize the pharmacological and the therapeutic actions of these interventions. So this study, this scoping review was conducted accordance with the PRISMA guidelines. The data sources are classical Siddha texts. 100 texts were reviewed with the research papers found from the PubMed and Science Direct. The eligibility, the inclusion criteria was majorly, which was including the Siddha classical texts and mainly for the type 2 diabetes and excluding the other metabolic disorders. So this is the entire flowchart of Prisma thing. So we found that 19 Siddha formulation are majorly formulated and given to the patients, and there has been a great results in it. So I want to mention these 19 types. First we have in the Churanam, we have Madhumega Churanam, Amukra Churanam, Sindil Churanam, Trifla Churanam, Parangipatai Churanam, Navalpatai Churanam. So these majorly have effects on the hyperglycemia, hyperlipidemia, and also the insulin resistance and conditions such as neuropathy and burning maturation and retinopathy, etc. So we have pharmacological actions of these as anti-diabetic, hepatoprotective, antioxidant, enzyme inhibitory, majorly the alpha amylase and alpha glucosidase, also regulates the overall metabolism. These also have the pharmacological actions in the management of lipid and also improves the insulin sensitization. So we have in the Kudineer, we have Avarai Kudineer, Nilavembu Kudineer, Sirupile Kudineer and Arinjiyadi Kudineer, which has potential action in hypoglycemic action, enhances the insulin sensitivity, nephroprotective and also hepatoprotective. Then we have in Parpam type we have Gandhaga Parpam and Sangha Parpam, which are majorly given for polyuria condition, diabetic nephropathy condition and gastrointestinal imbalances. Then we have Keelanelli Mathirai, Kumari Legium, Mahavira Mirga, Tanir Vitani, which are majorly administered for all the metabolic imbalances and digestive issues, and also hyperglycemia and non-healing ulcers, which are associated in it. Then we have in Chanduram type, we have Abraga Chanduram, Linga Chanduram, Rasa Chanduram, which has major effects on the neuromuscular disorders and nervous stability. We also have the external therapeutic approaches in which we involved the four major therapies, which is Tokkanam, Varmam, Ottradam and Kattu. We have in Tokkanam we majorly use medicated oils such as Mattan Thailam, Vadakesari Thailam, Kundariga Thailam, Pinda Thailam, Mahamegaranjaga Thailam, which has healing property for the non-healing wounds associated in the conditions such as diabetic foot. We have Varmam therapies which are proven to be very effective for conditions such as frozen shoulder and neuromuscular pain. Then we have Ottradam with medicated oils, which are also effective in deep-seated diabetic ulcers. Then we have Kattu process, in which we can use for the wash, Tirifala and Padigaram, which has astringent properties. Then we have topical application of oils and dusting powders as Sangha Parpam and Palagarai Parpam. The discussion majorly is that Siddha can be brought into the major diabetic care by both internal and external therapeutic approaches. The conclusion is that even more extensive studies has to be done for the phytochemical actions of each ingredients that has been used in each of the formulation. I want to acknowledge my college for supporting the review, and these are the references. Thank you.
Thank you. We appreciate being a second professional, BSMS, you have come out with a elaborated presentation on Siddha system of medicine for diabetes.
Thank you, sir. Thank you.
Okay. In coming years, you have to come with clinical
Sure, sir.
trials
Sure.
and present. Wish you all the best.
Thank you so much, sir. Thank you.
We have come to the end of our paper presentation session. I now request our chairperson and co-chairperson to share a few words about the session.
First of all, I would like to thank the organizers for giving us the opportunity. For continuously for the fourth day we are sitting here, and it's a nice experience. And I congratulate each and every presenter for coming out with different ideas for your presentation. It was really fine to hear you all. And I would like to thank Dr. Muthupriya for her patient organizing of this session. Let us give a big hand to her. And actually, this National Ayush Conclave is happening here after a very, very long time. And I would like to congratulate and applaud Dr. Vijaypal and Veeracholan for taking the initiative and accepting all your oral presentations, and wishing every one of you a great success in your career in future also. And the PG scholars especially, one small suggestion, please come out with more clinical trials, not coming with only single studies, okay? Because you are all representing your institution, you have wider IPD, so come out with more number of cases for clinical trials. So I once again thank the organizers for giving the opportunity.
Thank you. Thank you to my professor, Dr. Hariharan sir, to make me as a co-chair. And I wish us all the doctors. And nowadays, I miss something in this place actually. We can use our AA for some more things. Like, because past 5 years, everyone is saying to use the AA. So some of your doctors are a new Zen here. So you can use the AA to make little bit more database collection, everything. Because we need a lot of evidence-based presentation. So I wish all the doctors for the best and for the future care. Thank you.
Thank you, sir. At this moment, we sincerely thank our respected chairperson and co-chairperson for their guidance and support during the session. I request Dr. Pandian sir to kindly felicitate our chairperson, Dr. Hariharan sir. I also request sir to felicitate our co-chairperson, Dr. Dhanvantri Premvel sir. With this, we come to the end of the paper presentation session. We thank all the presenter, participants and audience for their cooperation.